Good afternoon.
Welcome,
Madam Chair. Yes, ma'am. Thank you very much. Thank you, members of the committee, for letting me come visit with you. I will be mercifully brief because when I went by all your offices last night, the promise they extracted from me was that I would not testify unless called. So I just want to, I'm here on behalf of the Travis County Commissioners Court. We delivered to your offices yesterday a resolution of the court and a letter from our judge, Sam Bisco, encouraging the legislature to look at Medicaid expansion as a good option, both for the people that all of us serve, and particularly for counties who right now bear a very large share of the cost of providing health care for the uninsured people in Texas. In Travis County, we have over 200,000 people who are uninsured now, medically uninsured. And although this bill probably, or Medicaid expansion itself, would probably not bring everybody into the fold, it would make a big dent for us and would really help us address other health care needs that we have in the community and so forth. So we want to encourage the committee. I'm here actually in support of both bills that have been laid out today, just because what we're really in search of is a solution to the problem that we at the local government level have in terms of providing health care and ensuring the health and prosperity of our citizens. When kids miss school, when people miss work because they got to take the sick kids to the doctor, it really affects our productivity as a state as a whole, and we want to do everything we can as a collectively to do it. So I want to thank you all for the patience you've shown today and listening to all the testimony. It's obviously a very important issue. I particularly want to thank Chairman Coleman and Chairwoman Kokors for also participating in this, even though they're not members of the subcommittee. And thank you for the attention you're paying to this issue, and I'm happy to answer whatever questions you have.
I have a question.
Yes, ma'am.
After hearing Mrs. Wogemuth testify, that cause you to worry that so Maine and Arizona didn't see a decrease in their uninsured? Do you think that could happen here?
It is clear to me, and first of all, you are now at the very outer limits, Ms. Crownover, of my expertise about Medicaid and health care delivery. But it's clear to me, for instance, that even if we did Medicaid expansion in sort of as called for by the Affordable Care Act, not all the medical needs of all the people in Travis County would be met. So you're still going to have some people who, because they fall into some of the gaps in the income thing or some of the medical needs they have are not necessarily covered under those programs. So we're not going to completely eliminate the uninsured, and that would be a great goal for our state, but this is a much more modest goal and is an achievable one for the state, and we think it would be good for the state to move forward in this direction.
Thank you.
Madam Chair,
yes.
If I could just add some clarity to the Arizona. You know, Arizona was one of the few or only states that didn't have a Medicaid program. They actually had something different than a Medicaid program, and then when they did the Medicaid, what we're calling the Medicaid expansion, that's when they adopted a full Medicaid program for the state of Arizona. So, you know, it's really interesting. They had a very truncated deal because it wasn't a Medicaid program. So in terms of those statistics, you have to look at it from that perspective, that they didn't move into one until about that time, 2002, or maybe a little bit before that.
Thank you for being with us.
Madam Chair, thank you very much.